Morning, folks. Happy Friday. It's actually supposed to be a decent day out there for this time of year, so maybe get a little walking in this afternoon. A few things to cover today. Number one on the list is consistent. We still have 27 as of today total positive cases of COVID specific to the nursing home. 24 of those are still in-house. I met with Dr. Bach and Dr. John Bach, our medical director, this morning, and most of those residents that are positive are doing well. Which leads me to the other issue. Some of the residents who actually tested positive early on, and that's before Thanksgiving, are actually recovering well. And a couple were actually moved out of the COVID area this week, and several more are slated to be moved off of that COVID area in the next few days. So, kudos to the clinical team that is working very, very hard down there. And, it's certainly wonderful that some of our residents continue to improve and actually continue to improve to the level where they're testing negative after a couple of weeks and are able to move off that unit. So that's good. We still have, we have staff members that are coming back that have gone past their 14 days and have tested negative and have come back to work. We do continue to have a trickle of staff that are going out at the same time. But we have been able to successfully continue to staff and care for the residents, specifically down in skilled nursing, even with the staffing challenges that we've had relative to staff testing positive for COVID. So again, tremendous kudos to thanks, and can't say enough for the staff that are working in the health center, specifically skilled nursing right now, with the day-to-day challenges that they're facing. Number two on my list is our number is held steady at 5 independent residents. We're still waiting on a possible false negative on an additional. We haven't gotten that information, or a false positive on an additional, but we haven't gotten that information yet. But as of right now, 5 independent residents in Williamsville, and actually 2 of the 5 are well on the road to recovery and have tested negative, so that's good. The one person that we had at Gate Circle on the independent side has actually recovered and tested negative twice as well. So I want to make sure that we talk about the positives. I know everybody is keeping these residents in their thoughts and prayers. So for those of you who are doing that, it's certainly working. So thank you, and keep up the good work. A lot to talk about relative to the vaccine. So just yesterday, I was on a webinar with several of our staff members with the New York State Department of Health, and there was about 2,000 people on this webinar. So I can give you some official dates. So of course it was yesterday that the vaccines were given some preliminary approval or emergency approval by the FDA. So as a result of that, we know a couple of things. We know several things. We will be getting the vaccine here, and it will be the Pfizer vaccine initially. So those of you who have been asking me what vaccine it's going to be, the initial vaccine delivery to us will be the Pfizer vaccine. That vaccine will be administered by Walgreens. You heard me talk about that. So when the vaccine gets here, Walgreens, their staff, pharmacists, etc., will be the ones to bring it here, vaccinate people during the days that it comes, and they will, if there's anything left, they will take it away. The Pfizer vaccine is the vaccine that has to be refrigerated at very low temperatures. So clearly, we don't have the capacity to sub-freeze this stuff and keep it frozen at the very low temperatures, but Walgreens does. And so they're going to be administering the program for us. I can can tell you that the vaccine, it will be here sometime either on December 21st or after that. That December 21st is the date that the vaccine will start to be delivered and administered in nursing homes across New York State. That's the official date given to us just yesterday by the New York State Department of Health. Now, I hope that that's the official date. That's what they're telling us, and we'll take their word at this point. So just because December 21st is the official date doesn't mean that it's going to be at Canterbury Woods at the 21st. It means that that's when they're starting their vaccination program, and the doses are going to be available for New York State nursing home residents and staff members starting on the 21st. Ours could be the 21st, could be the 23rd, could be into January, and that's the reality. So I want to confirm this as I've been talking about it. As of right now, according to the webinar yesterday, the first people that will be vaccinated will be nursing home residents and a portion of our nursing home direct care staff. New York State is managing the amount of initial doses that they have. So the initial vaccination process will only include nursing home residents and a portion of our skilled nursing staff. Now, as I talked about, many of our nursing home residents have already had COVID, have COVID right now, or may get COVID between now and the time that Walgreens comes in to vaccinate. Many of those folks will still be vaccinated. Many of our staff that have already gotten COVID and retired and not retired and gotten better will still be vaccinated during this process. And there's a criteria that I'm not going to go into today, but it has something to do with they've recovered and it's been X amount of days and so on and so forth. But they will still be vaccinated. Skilled nursing residents and skilled nursing staff members, even if they previously had COVID, they will still be vaccinated during this process. This is considered 1A. If you look at who's being vaccinated in New York State and throughout the country, this is the 1A group. The 1B group, which would be our independent residents, the rest of our staff, and assisted living, is yet to be determined when that date is going to happen. It could happen in late December, could happen in late January, and I just don't know. New York State does not know, and it's based upon the amount of doses that they have access to initially. So I don't have any better news for independent residents or the vast majority of our staff, other than you are in 1B, and that may happen in late December, or it may get pushed out. The more information I get, the most updated information I get, I will pass it along. At this point, I'll go back. Nursing home residents here at Canterbury Woods and throughout New York State, and a portion, not even all, a portion of our skilled nursing staff will be vaccinated starting on December 21st. Might be exactly on the 21st, it might be out a little bit. Keep in mind, with the Pfizer vaccine, which is the one initially that New York State will use for the initial vaccinations, that's a 2-shot dosage. So those that get vaccinated, the first day they come in will be given their second shot on day 21, whatever that is. Walgreens will be back, and those folks who got that vaccination will be vaccinated again 21 days after the initial vaccination. At the same time, during that time period, Walgreens will also vaccinate new residents to the nursing home that haven't been previously vaccinated. So as we know, the nursing home will continue to have new residents come in. They will be vaccinating these folks as well during that time period. I know I'm throwing a lot of information out. I'm going to continue to talk about it, but again, vaccines will be available to us, and New York State through Walgreens will start vaccinating the nursing home and a segment of our employees starting December 21st. Independent residents, the majority of our employees, and assisted living will not be in the initial phase of vaccination. That's going to be down the road, probably into January. Again, as I've been stating, we're as the information flows, we're going to share it with you. If you have any questions, rwallace@echa.org. I do have to report with great sadness that a second resident of ours here at Canterbury has passed away. This person passed away yesterday as a result of the COVID virus. So this is our second resident, unfortunately, that has passed away. Please keep this person and certainly their family in your thoughts and prayers. And please continue to think about and pray for, if that's your choice, for the residents that are afflicted with this virus and continue to fight for their health. Obviously, these are the worst things that I have to report is when we have a passing. I will be back here on Monday. I'll actually be away on Monday, but I will be taping something and sending it, and it'll be played at 10 o'clock on Monday. Thank you, and don't hesitate to reach out if you have any questions.